Acromioclavicular APs and PAs. So what we're going to work on here is the acromion. Doing an AP motion to the acromion followed by a PA motion to the acromion. Because we're working on acromioclavicular, typically what we're usually trying to do is stabilise the proximal bone, mobilise the distal bone. Proximal bone in this case being the clavicle, but it is quite a difficult one to try and stabilise. We're going to do as much as we can to stabilise it for the motion that we're trying to restore. So if we're doing an AP of the acromion, first of all, very, very important you find it. So go along the spine of the scapula, which will bring you out to the posterior lateral tip of the acromion, which is therefore just there. So just follow that line. You can feel it in the shoulder, nice and easy. Follow that line out and round, and there you'll get to the tip. Okay, so then I can feel that tip all the way forwards, and now I have the acromion between my index finger and thumb. So that is all acromion just there. Clavicle working across and round. Remember, it is curved. So round and out here, just to the end of the clavicle, because there is a very, very slight dip just in between the two, that being the acromioclavicular joint. For an AP then, I want to hold on mainly onto this anterior surface, but as I've said before, it's nice just to have my finger on the back of the acromion too. This is if you have the strength to apply the pressure through your thumb. If you don't, then feel free to use different aspects of the palmar part of your hand. So for instance, coming into this region here, or if you want to use pisiform, then applying the pressure there. But either way, if you're going to do either of those, then that's absolutely fine, but you won't be able to hook your hand round onto the back of the acromion. It's not the end of the world, it's just I like to be able to feel the whole bone that I'm moving if possible. For the clavicle, what we're going to do is try to, as much as possible, fix the clavicle. So this is the clavicle here, and I'm just going to bring my fingers just ever so slightly into the clavicle, holding it as much as I can upwards. Okay, so just into there and then pulling slightly anteriorly. It's not perfect, and I'm using as many fingers as I can, so in this case 4 of my fingers to try and stabilise, because what you don't want to do is just hook in with one finger and think that you can pull that clavicle forwards. It's really, really uncomfortable. So I'm just trying to spread that load with a few different fingers. Then here onto my acromion, and then I'm going to apply my anterior posterior motion. So that's coming from this right hand just in here. Okay, so here we go. Taking up the slack, going in a bit further, and then going towards end of range. And if anything, I can feel this clavicle moving. I can't really stop it, but at least I can feel the relative motion, therefore, between the clavicle and the acromion. Okay? So if I was to do, say, a grade, I'll do all 4 grades on this one, actually. So here we go. So taking up the slack, pain just there, grade 1. Moving into grade 2, so let's just test again. Taking up the slack, grade 2, emphasising pulling off. Yeah, so I'm emphasising coming back away from posterior. Now going for resistance, into resistance there, backing off, grade 3. And then I'm going to go for my grade 4, so feeling for resistance, in a little bit more, just there towards the end of range, back off slightly, grade 4. For performing a PA then, so taking the clavicle anteriorly, so we're going to come round onto the back, and that's where we're then going to hook either our fingers and thumb as we did before, or you can actually place the acromion into here if you just curl your finger round that way. So then what you can do is just place it into there, like that. So it's quite a difficult one to show on the camera, but just like that. And then I allow my thumb to come over to the top. The thumb just being, again, so that I can feel the bone. The motion is all coming from here. Okay, so I'm hooking up and round, just like that. Now the clavicle needs to stay down, so now I'm just going to apply a pressure to it, pushing downwards. You could either go with fingers this way, thumb this way. It can be a little bit uncomfortable having your hand across someone's necks, which can be a little bit uncomfortable, or you can apply a pressure down with your palm in this direction. Obviously for the camera shot that we're trying to do, that probably works just about okay, although we are blocking the light. So I'm just going to put my thumb on that position just there. Either or, it doesn't really matter. Okay, so we're going to apply the pressure coming upwards. So lifting that acromion up, 2 and 3. Okay, so if I do all 4 grades, so grade 1, test again, grade 2, let's test again, into resistance, grade 3, get nice and progressive with your motion, nice and fluidic. And then for grade 4, test the range into resistance towards the end, and then grade 4 just there. And there we go. Glides of the clavicle. So we're working the acromioclavicular joint, but this time we're actually working it the other way around. So we're working the proximal, ideally with the distal being fixed, but in this case the scapula is relatively mobile, but there's not too much we can do about that. So we're performing an AP on the clavicle, is just like doing a PA of the acromion, because they're going in opposite directions. However, this time we're just going to apply that pressure to the clavicle. The scapula is being fixed against the bed, so we don't need to try to control it, which is quite a nice part for this. So we need to feel that clavicle and come towards the distal end. Be very careful again with your handling in terms of not placing it across the patient's neck. My hands are quite big and this shoulder is relatively narrow, so another alternative is to put your hands, both hands in this side, but again I would just feel like I'm pressing my hands up against the side of the neck if I was trying to perform that. So therefore this is slightly easier for me to perform. So then thumbs just placed onto there, and then we're going to apply our AP pressure. So taking up the slack, into resistance, and end of range resistance. So if we're performing our grades, this could be a grade 1, really nice and small. If we show a 3, into resistance, come off, this would be my grade 3. Longitudinal, I'll have to cut that and do it from here. For a longitudinal cordad, we're going to apply the pressure straight down on the clavicle here. We ideally therefore need the shoulder to be relatively depressed. And then we're going to come in to find the distal end of the clavicle, and then we're going to apply the pressure pushing straight down the body. Taking up the slack towards resistance, further into resistance. If I take up the slack again and then just show you a grade 1. Do it again, take up the slack. Grade 2, do it again, taking up the slack, further into range and perform a grade 3. And then obviously a grade 4 is towards the end of range, typically. Nice and small. If you've got very, very bendy thumbs, again, course, we can change our handling to be perhaps more in this way, so using pisiform onto the clavicle, pulling that shoulder back, and then performing the technique this way. So there's always an alternative option. Just got to work around your patient and your anatomy.